So how did you get into studying and treating dysautonomia or POTS to begin with?
So when I first joined Johns Hopkins, I was very interested in muscle diseases, and I was in the muscle disease clinic. And when I saw muscle disease patients, among those people, I've seen group of these people who complain very weird and various muscle symptoms and severe exercise intolerance. And I did a little more research into it and found that their symptoms are related to autonomic nervous system. And I was really fascinated by the fact that autonomic nervous system can cause severe muscle symptoms like that. And at the same time, these people, their symptoms have been dismissed by other doctors, and there are not really many other clinics that I can send the patients to anyways. So I felt like I had to start the clinic.
Are you seeing an increase in patients at your clinic since the onset of the pandemic?
Absolutely, yes. There's a huge increase in referral to our clinic after pandemic. And it's not just Hopkins. There are still a few more POTS clinics out there in the United States and other countries. And my colleagues in those clinics say the same thing too.
What's the wait time to get into your clinic right now?
Oh God, we are like growing. Like I think I have like 10, 11 months right now, which is a problematic because these people have very disabling symptoms. Dysautonomia is a very collective term that refers to any disease condition that affect autonomic nervous system. It's very difficult to say how many types of dysautonomia exist out there, but you can imagine once your autonomic nervous system get dysfunctional, can cause multiple symptoms affecting multiple different organs at the same time.
And what is POTS specifically?
POTS is a form of dysautonomia. POTS refers to postural orthostatic tachycardia syndrome, and it is technically defined by heart rate increase by 30 to 40 points from lying to standing position. And at the same time, it has to reproduce their typical symptoms of chronic fatigue, brain fog, palpitation, anxiety, and various gastrointestinal symptoms. So the term POTS, postural orthostatic tachycardia syndrome, was first coined by Dr. Philip Lowe at Mayo Clinic in 1993. So it's a relatively newer term, but this has been known for a very long time in the history as different names. So for example, in 19th century, it was called neurasthenia. That literally means nerve exhaustion. And some famous figures in history, such as Dr. Sigmund Freud, the father of psychology, is known to actually taking care of this patient before. Dr. Freud, he actually in his early publication, he tried to distinguish hysteria and neurasthenia very differently. He thought that neurasthenia is more organic disease, whereas hysteria is more pure psychological form of this condition. And he chose to study more on hysteria, not neurasthenia or POTS. And he became very famous in psychology. Later on, POTS was also discovered in young soldiers returning from American Civil War, and at the time was called soldier's heart or Da Costa syndrome, which is named after the doctor who described the soldier's heart. So it exists in different names before.
Do you know when they started teaching it in schools?
So I don't even think they're teaching it now. In most medical schools, to be honest, I can't think about any medical school that I know or including this POTS in the regular curriculum. As far as I know, most doctors learn about it in their just clinical practice.
Wow. Wow. No wonder it's so hard for people to get a diagnosis.
One of the very important functions of autonomic nervous system is that it regulates our blood flow. And how is it regulating our blood flow? Now you see the picture here. This is blood vessel, the red blood vessel here, and you see this yellow stuff that's wrapping around the blood vessel. So this is called sympathetic nerve fiber, which is part of our autonomic nervous system. And basically, when it gets activated, it kind of squeezes or dilates blood vessel in a way that it kind of pumps the blood. Of course, in actually it's a little more complicated than this one, but very simply, this is just kind of pumping action. So when it gets activated, it pumps the blood to the muscle. For example, if you're exercising your muscle, or if you're studying or concentrating or thinking, it sends more blood flow to your brain. And also, when you change your position, especially from lower to higher ground, blood is a water, it doesn't go up and down by itself. So you kind of have to pump the blood against the gravity, otherwise we're all gonna collapse. I think the growing evidence for POTS is that the POTS underlying pathology is the nerve damage right there in this particular nerve that's regulating blood flow. So as a result, what happens is that it's a pump failure. So they can still move their arms and legs because their muscles fine, but their body system cannot support the blood flow as they move around. The same thing with the brain, they get brain fog because they cannot regulate blood flow, increase blood flow to the brain whenever they have to concentrate or studying. And the typical symptoms of POTS, when they stand up, they get dizzy or lightheaded. That's presumably coming from this pump failure. They cannot pump the blood against the gravity. Now, at the same time, that's not the end of the story, unfortunately, or fortunately, our body have some kind of sensor that can detect this pump failure, and our body increases set of chemicals that's including mainly adrenaline to compensate for these symptoms. So basically, they induce tachycardia, fast heartbeat, to send more blood flow to the body. But at the same time, the problem is that too much adrenaline is causing a lot of symptoms such as sleep disturbance. They can't really sleep. They get restless. They wake up in the middle of the night, and causes a lot of GI symptoms, gastrointestinal symptoms. They get nauseous, constipated, and reflux and indigestion happens. And overall, they get anxious and get a lot of kind of uncomfortable hot flushes and so on, among many, many other symptoms. The nature of symptoms of POTS is kind of unique in that any other nerve disease, neurological disorders, I say that their symptoms are kind of one-dimensional, in the sense that, for example, if you cut the nerve in your finger, you get the numbness in your finger, and you don't have to be a doctor to know that your nerve is damaged there, right? But in POTS, it's thought to be from this nerve dysfunction and pump failure, but because our blood flow goes to everywhere in our body, the symptoms are presenting in multiple directions. So like I said, I call these pump failure symptoms: brain fog, exercise intolerance, fatigue, headache, and other things here. At the same time, like I said, there's adrenaline symptoms or sympathetic overcompensation that causes insomnia, anxiety, GI symptoms, and palpitation there too. So like I said, I think it's important for both patients and also local providers to recognize that there are multiple symptoms as a constellation of symptoms, that suggests, dysautonomia or POTS as a diagnosis. So the recognizing this cluster of symptoms, I think, is really important for the patients. And also it's very important for the treatment as well.
One of the things that's been really interesting to me is that there might be a connection between dysautonomia and autoimmune diseases. Can you speak a little bit more about that?
So dysautonomia is, again, collective term for any autonomic nerve dysfunction. And autoimmune disease is also a collective term that refers to any disease that's coming from autoimmune attack. As you probably know, the immune system is there in our body to protect ourselves from virus or bacteria or foreign bodies. But sometimes our immune systems can get confused and recognize our own body tissue as some kind of virus or bacteria and continuously attack and inflame the body tissue. So it can cause different type of disease depending on which organ they attack. But basically what may be happening in post-COVID syndrome patients is that possibly these people who get post-COVID syndrome, their nervous system's molecular structures may look very similar to the molecular structure of COVID virus itself. So what happens is that their immune system, they develop a thing called antibody. That's one of the weapons of our immune system to get rid of the COVID virus. But even after virus is gone out of their body, the antibodies still recognize our body tissue, in that case, the nervous system, autonomic nervous system, and continuously attack and inflame the nervous system. And the thought is that that's why they develop post-COVID, long COVID syndrome. In the case of dysautonomia and post-COVID syndrome, the growing suspicion is that it's attacking autonomic nervous system that particularly regulates our blood flows.
And in the patients that you're seeing, did they have extreme cases of COVID or mild cases of COVID, or does it vary?
Yeah, most of them had mild or asymptomatic cases of COVID infection before they developed long COVID syndrome. One of the statistics shows that just about 90% of these people who develop long COVID syndrome only have mild cases of COVID infection.
Do you have any idea how many of the patients you're seeing now who had COVID and have developed dysautonomia also had some form of pre-existing condition, especially an autoimmune disease?
Yes, that's actually a very interesting and important question that I may not have the best answers for, to be honest, at this point. So we know that POTS or dysautonomia, there are a lot of overlapping syndromes, such as Ehlers-Danlos syndrome, which is a connective tissue condition that presents with flexible joints, pale skin, and hypermobile joints. And also mast cell activation syndrome. These people develop some kind of allergy-like symptoms. And overall speaking, most of my patients in my POTS clinic, they are predominantly female in their usually 20s and 30s. And that's not just my POTS clinic. Actually, a lot of other clinics who see the similar patients see the same pattern. And we are beginning to see this similar pattern in post-COVID POTS patients as well, predominantly more female. And a lot of them actually have some pre-existing conditions, EDS, mast activation syndrome, and some autoimmune disorders like Hashimoto disease, thyroiditis in the past. So we believe that there may be some genetic predisposition that make them more vulnerable to get dysautonomia or POTS after COVID infection.
Do you think that this is a permanent condition for these patients, or do you think that this is a phase that they'll grow out of?
I think this is probably a permanent condition, especially if this is an autoimmune disease. There's really no reason to think that it's going to go away. As you probably know, our immune system has such a thing as immune memory. Once our immune system memorize certain molecular pattern, it doesn't go away. Just like you get the vaccine, you're not going to get the same disease for the rest of your life. So that's the same as autoimmune condition. It's going to probably stay for a very long time.
What sort of treatments can you recommend for people who are diagnosed with dysautonomia?
All the treatments for POTS, this is not for cure at this point. We don't have any cure. We still need to do more research to even just understand better about this problem. First, I think it's important for the patients to start the treatment early on and recognize the problem and start the treatment early on. And also understand that the treatment can take a little bit of time. It's not like there's one medication they can take and get them better. It's kind of like training over a few to several months. We kind of help them, understand their disease and, help them with some drugs or dietary modification and how to do physical exercise. Imagine water balloon, and that's attached to a pump. The normal person, when we stand up, this pump squeeze the balloon so it doesn't collapse. For POTS patient, the pump is broken. There are two approaches here. You can either try to fix the pump, immune modulating therapy, or immune suppressing therapy to stop the inflammation to fix the pump. But unfortunately, those are not available at this point. We need some more research to get there. But that's not the bad news necessarily. We can focus on the water balloon there and imagine filling the balloon with the water and expand the balloon, then it's going to build up the pressure and it's not going to collapse, right? So we call this a volume expansion therapy. It's not a rehydration because they're not dehydrated. We're trying to expand the balloon. So we ask them to drink huge amount of water and a lot of salt to keep the water inside of their body. And on top of that, we use a lot of drugs to facilitate that volume expansion. And eventually, physical therapy and exercise is really targeted towards to volume expansion, because basically we are training their skeletal muscle as a pump, and that pump can increase their blood volume significantly. The immediate goal is to get them better close to their baseline, and a lot of them actually can get back to their work or school or kind of close to the baseline.
Can you tell us a little bit more about the research that you're doing?
I think there are a few different research projects that's involved in post-COVID and POTS and dysautonomia. But one of the most important and urgent projects that I'm involved in is to prove autoimmunity in post-COVID syndrome and POTS, because there's actually some practical and important implication of those research. If you can prove that this is autoimmune disease, that really opens up the possibility of using certain immunomodulating therapy or immunosuppressive drugs. And oftentimes these drugs are very expensive. So through research, we can eventually make insurance companies to pay for these expensive treatments to get them better.